Have you ever looked in the mirror and thought, my face doesn't look too bad, but what happened to my neck? This is a common concern I hear from patients. In fact, many people come into my office convinced their neck has aged much faster than the rest of their face. But here what surprises them. Your neck usually isn't aging faster than your face. It's simply the first place you notice the changes. Hi, I'm Dr. Kenneth Yu, facial plastic surgeon, and understanding why this happens is important because it can completely change which treatment would actually give you the result you're hoping for. When people think about neck aging, they're usually referring to loose skin, vertical neck bands, fullness beneath the chin, or a jawline that is not as sharp as it used to be. Naturally, it's easy to assume the neck itself is the problem, but facial aging rarely works that way. One of the biggest misconceptions about aging is that individual parts of the face get old independently. They don't. Your face ages as one connected system. Over time, the deeper support structures beneath the skin begin to relax. The fat that once gave the face youthful contour slowly shifts downward. Skin loses elasticity. Even the facial skeleton changes subtly with age, reducing the structural support that once held everything in place. There have been well-documented studies showing how our facial skeleton slowly shrinks in size, which detracts from your support. These changes don't happen overnight, and they don't happen in just one area. As these deeper structures descend, one of the first visible consequences is a loss of definition between the jawline and the neck. That's why so many patients believe their neck suddenly became the problem. In reality, what they're seeing is often the result of changes that actually began higher in the face years earlier. This is also why simply tightening the skin on the neck doesn't always produce the natural improvement patients are hoping for. If the cheeks have descended, if the jawline has softened, if facial support has weakened, treating only the neck may improve one area while leaving the overall balance of the face unchanged. And that's an important concept. The goal is not simply to tighten your skin. The goal is to restore harmony and restore a youthful position. Every patient ages differently. Some patients truly have isolated neck concerns and may benefit from a procedure focused specifically on the neck. Others achieve a more natural result by treating the face and neck together. That's why I spend so much time during consultations evaluating the entire face, not just the one feature that's bothering someone the most. Because the feature you notice first isn't always where the aging process actually began. One of the principles I always share with patients is this: your face does not age in pieces, it ages as a system. When you understand that, the treatment decisions become much clearer. Instead of asking, how do I fix my neck? You begin asking a much better question. What's actually causing my neck to look this way? And that's often the difference between simply looking tighter and looking naturally refreshed. If you found this video helpful, I'd encourage you to subscribe to this channel. Every week I publish new videos to help you better understand facial aging, facial plastic surgery, and how to make confident decisions before choosing any cosmetic procedure. And if you ever wonder why your jawline seems to disappear as you get older, that's exactly what we'll talk about in the next video, because it's closely connected to everything we discussed today. Thanks for watching, and I'll see you in the next one.